Thank you for joining in. You're welcome. How are you today? Hello, hello, hello. Thank you for the live. Thank you for joining Segura TV. Sister Ebu. How are you today? GM to Labos. Thank you for joining me. Going well. Just finishing that consultation. Thank you. Thank you. Welcome, JM to the box. Okay, JM, why do you want to know my age? JM to the box. Yes, thank you, Sabrina. Thank you so much. Yes, thank you so much. How is your day going? How are you today? Yes, tap, double tap on your screen. So there are some things that your doctor would actually like you to know. Okay, GM Tilabot. Yes, I am. Yes, I am. I am a medical doctor. By God's grace. Dima is here. Hello, Dima. How are you doing? Good day to you, Dima. How is your day going? Yes, JM. Yes, I'm a medical doctor. I'm a family physician. I practice as a family doctor. Okay. Thank you for the light. Okay. So I just want to share with us some of the things that your doctor would like you to know. Alright? Yeah. Are you interested? Some of the things that your doctor would like you to know. Oh, thank you. You're welcome, Sabuna. Hey, Dr. Soyemi. Thank you, Dima. Wow, Sabuna is a exceptional medical doctor. Yeah, and thank you for the comments. Wonderful comments. Thank you. Don't mind the background noise, okay? I'm still having some activities within the area. Yes, thank you, Dima. Dima is asking, how are you doing? I'm doing fine. And how are you too? Sabina? Yes, ma'am. I'll be right back, okay? You need my attention, alright? Okay, someone is still here. So thank you for staying tuned. I had to assist with something there. JM says, Doc, you are very handsome. Thank you, JM. Thank you. Sabrina says, Dima, I miss your face. Dima says, Boom, I'm planning to come live. We'll still carry. Wow, Dima, sorry. When did you plan to come live, Dima? When did you plan to come live? So you needed to catch some rest, right? And then Sabrina is interested to know and learn. Yes, you've been interested to know, yes, know what your doctor would like you to know. Hello? Let me look for cannula, blue cannula. Look for many patients there. Okay, welcome back. Thank you for joining. Remember to double tap on your screen, subscribe, and like the channel. So, what would your doctor like you to know? People are waiting. Yes. Sabrina says we'll be waiting. Yes. Yeah, let's keep double tapping, people. Our doctor should be back shortly. Thank you. Thank you. I'm back. Dima says, how is it going? Sabrina says, going well, Dima. That is faithful, counting down to your birthday. Wow. Countdown to Sabrina's birthday. Happy birthday in advance. So let's go, let's go. So let's go, let's go. Are you here? So we're celebrating with Sabrina soon. Tuesday, all roads lead to Sabrina's house. Who's going to be there? All roads lead to Sabrina's house. Not just a channel, but a house. So we are going to meet there. She's going to share with us the location. Okay, you're welcome. Thank you for joining me. How are you doing? How's your day been? So the first thing your doctor would want you to know is that for you as an adult, it's important to have a regular medical check. Very important. Very important. No matter how healthy you are or you think you are, doing a medical checkup is very important. Very important for your health. And that's actually to help to identify early enough if there are things trying to come up in your body, which we do not pray for. However, we need to check ourselves regularly to have a comprehensive medical check. Yearly medical check is important, especially from the age of 40, even if you are 30 in Nigeria, 30 It's not too early for you to have a comprehensive, a yearly checkup. Very important. Your doctor would like you to have that. Okay, so that's the first tip. Stay tuned, we'll be sharing more. Okay, thank you. Okay, Tommy Singh, I recognize you. Thank you for joining me. How are you doing? Okay, so you're doing very well, Doc. Thank you. Yeah, you're welcome. You totally agree, yes. It's important to have a regular medical checkup. Yes. Okay, so I need to mention that apart from the fact that some things can be picked up early, it's appropriate to note that that also applies to people who have some medical conditions that need regular checks. So once in a year, there are some medical conditions like people with diabetes who should have a regular eye check because diabetes can affect the eyes. So they should actually have a regular eye check yearly to assess for the function. You don't have to wait till you have a symptom or a complaint because some of those symptoms are actually as a result of complications. So it's better to prevent complications by showing up at the clinic, at the hospital, for a checkup. Okay, so for people with hypertension also, be a need to have this comprehensive check. Okay, and then people living with HIV, people living with some other chronic medical conditions, even sickle cell anemia, require such medical checks, which is very important. And there are some genetic conditions. There are conditions that are passed from one generation to another, right? But this can easily be picked. For example, an individual may have a history, family history of diabetes, which can be picked early enough during a screening. Some people have what we call state pre-diabetic stage where they are just at the borderline close to developing diabetes. So with such people, having a lifestyle change, dietary modifications may help them to actually pick up. Okay, thank you, Tomisi. Okay, you say you totally agree. Yes, thank you. How often should the checkup happen? Yes, it should be yearly. Yes, at least once in a year. Some people actually go as far as doing 6 monthly, but yearly is okay. If you do not have any medical condition, you should actually have a yearly medical checkup. Very important. It could be any time in the year. It could be any time in the year. Some people do it at the end of the year. Some people do um, at the beginning of the year. So hope I was able to answer that. For every person, you should be able to do this yearly checkup. But for people who have already diagnosed medical conditions, they should do this as also required by their physician. I'll be back. Oh, thank you for your patience. I needed to assist with some work there. So I'm sure we are done with the number of times, I mean the frequency of medical check. Yes, the frequency is very important, very important, very important. So don't say I'm not feeling any symptom. You should have a checkup. Another thing is that if you have been diagnosed of any medical condition, this may not be for you, maybe for a relative, maybe for a friend, and then you have medications prescribed for you, then you should ensure that you keep to your prescriptions. You should ensure that you keep to your prescriptions. Your doctor will want you to do that, not for his or her own sake, but for your own sake. Yes, because for you to actually be placed on medications, it means that you actually need to have that. Okay, talking about prescription from your medical doctor after proper consultation, you should ensure that you keep to the prescriptions. Now, in terms of the dosage, talking about the quantity of the medication, the exact medication is what you should use, and then the quantity, the dosage, and the timing. Talking about the frequency of use, you should keep to that. Okay, some people, for example, people who are diabetic or even hypertensive, they take medications more than what is required or what has been prescribed. There is a tendency to actually develop complications. For example, someone that is treating diabetes, if they take more than required for lowering of the blood sugar, they can definitely have hypoglycemia, that's low blood sugar, and that can lead to a coma or even, death. So we need to note this. Your doctor would like you to take the number of times that you taking. All right, and then the type. I need to address this aspect of people using other people's drugs. For example, the doctor would want you to avoid taking an antihypertensive that belongs to another person, even though you both may be hypertensive, but you need to understand that except in emergency situations where there needs to be an intervention which is better given by a trained health professional, you should avoid taking other people's medication. People do that a lot. Say because this person has hypertension and they also have hypertension, it means they can just share. In such cases, such people even avoid coming to the clinic to be reviewed appropriately, which is not good. So it's important to avoid taking medications that belong to others. So drug abuse should be avoided. Drug abuse should be avoided. Welcome, Dave. Good to see you here, Dave. Greetings to you, Dave. Thank you for joining this live. Yes, you are right on time. Yeah, so we're catching up. It's been a while, and let's talk about what your doctor would want you to know and then to do. It's not just about the knowledge, knowing what should be done, but doing it is very important. So thank you, Dave. How is your day going? Sabuna, how is it? Okay, Dave is asking how you're doing. Thank you for the likes. Okay, so take note of those that I've mentioned already. There is a noise in the background. We need to talk more on this later maybe later today, and this evening we'll talk about what your doctor wants you to know. Yes, the noise at the background. So, thank you for joining in. See you later. We'll catch up later. Okay. See you. Bye for now. Bye. Thank you everyone for joining in. We have a meeting coming up soon. Thank you. Thank you. I'm not in the mall, I'm in the clinic area. Dave, I'm in the clinic area, not a mall. Okay, we just finished consultations and we have a presentation by a pharmaceutical company. I'm talking about certain medical condition and drug use. Okay, so thank you. God bless you, Dave. I appreciate everyone for joining in. Let's catch up again later. Bye for now. Bye.